Hi guys, welcome to my channel. My name is Dr. K and I want to welcome all of you to the Gynae Talks. This is where we discuss everything reproductive health, everything woman, everything man, everything just reproductive, and we learn these things. We get tested early, we get healthier, and a healthy you is equal to a healthy nation. So before I continue, please click the like button below, subscribe to this channel, and also share it with some of your friends, family, sisters, brothers, everybody, just everybody, because this is for everyone really. So if you check behind and check the videos I've had before, I've talked about your fertility miracle, and today I want to talk about preparing yourself for your first or second or third or fourth pregnancy. Join me. Now you see, we've talked about pregnancy before and we've talked about fertility, and there's so much I really want to tell you, because you know what ladies do here in Nairobi and anywhere this country, we literally go to the hospital when we are already pregnant, and ideally it shouldn't be the case. And I want to show you how to prevent any problem in your pregnancy and come early enough. So why do I tell you to come early? By the way, how early is early? I mean, come before you even get pregnant. You know why? Because there are things that you need to check, make sure you're fine before you can actually get pregnant. I'll tell you, for one, in other countries, when someone is, or a couple are preparing to get pregnant, they always go before they get pregnant. And this is because there's so much you need to know and you need to learn before you can actually get yourself pregnant. And these are the things that I really need you to know. So number one, you need to first visit your gynae before you get pregnant. Why? Because we are able to examine you, we are able to check your weight, we check your blood pressure, we check your sugar levels. Those are very important. You know why? Because hypertension is one of the causes of death in pregnancy. If you have diabetes and it's not well controlled, it's one of the causes of pregnancy losses. And you don't want to experience pregnancy loss when you've already lost the pregnancy. It's important to get tested early enough. Your weight also, you might want to make sure that you're of ideal weight also to get pregnant. And I think I must have talked about this. Sometimes even just being overweight or being obese can prevent you from getting pregnant. So if you keep an active lifestyle, if you're able to eat well, keep a moderately healthy diet, then you're able to actually get pregnant and keep a pregnancy till term. So we don't want any issues with that as well. So we do your weight, we do your check for your sugars, we also check your blood pressure. The other thing we usually do for you is you need to be on a supplement. It's called preconceptual care, and these supplements are very important for you and your baby. And the number one supplement that you need even before you get pregnant is folic acid. Folic acid is if there's anything you need to take in pregnancy and leave everything else, especially in the first trimester, is folic acid. You need to be on that folic acid way before. It really helps with your child's growth. It also prevents malformations, like you've seen babies with a brain malformation or a skull malformation or a spinal cord malformation. So you've seen things like spina bifida. Those things are related to folic acid deficiency. So if you can have it before pregnancy, that is the best thing to do and to have. So there are many different types of supplements out there. I will not mention one specific one, but as long as it has folic or even just the folic tablet itself, then you're good to go. Another one that we always do give, and give it a lot to women who have had pregnancy losses or have undergone IVF, that is in vitro fertilization, we give you something called junior aspirin. It is very important for maintenance of that pregnancy, and in most women we will start you on both folic and junior aspirin. It's very, very important, especially those ones who are likely to develop hypertension later on in pregnancy. So if you know that you've had high blood pressure during your previous pregnancies, pre-eclampsia, eclampsia, you need to be on junior aspirin as soon as possible. Okay, so that's another thing, and it's still part of the preconceptual care. Another supplement you need is calcium. Calcium is one of the the ones that help you form better bonds, protect you and protect the baby as well. So there's a lot of supplements out there, so you need to be on calcium supplement. So those three, you'll find yourself you'll need them as soon as possible, especially if you've had any issues before, pregnancy losses and etc. So we will put you on a supplement. Those are two main things that you need to do and prepare for your pregnancy. The other thing you need to know is, especially as a first-time mother, you need to understand what pregnancy entails. You need some consultation on what will happen, what to expect, whether you're going to have changes in your body. These things are very important because, as you can see, a pregnant woman will come to you and say, I have this vaginal discharge and it's just not going away, and maybe just the pregnancy itself can give you a heavier discharge than normal. So those are the kind of things you might need to know so that you don't panic during your pregnancy, and to also reduce the number of times you go on a visit to the hospital. So definitely you need to know and get help in terms of what you need, teachings, education on what changes you're going to have during your pregnancy. Assuming that you just discovered that you're pregnant, how soon, or you suspect you're pregnant, how soon should you test for pregnancy and which test is best for you? So first of all, when you're trying to get pregnant, you will visit the doctor. When you suspect you're pregnant, make sure to see your doctor. So once you miss your period for that month, then you can actually do a pregnancy test. Don't do it before the expected time of your period. Do it after, because if you do a urine test before, it might not give you the right answers. So the only one that can give you probable answer is another blood test, which is used to confirm pregnancy. So only test after you've missed your first period, like after you're sure you've missed your period, that's when you test it. If you're not sure and you're so excited, you really want to know whether you're pregnant, then a blood test would still be fine. But I think it's okay. You can always wait for your first period and when you miss your period. So that's for that. If you're preparing to get pregnant, you might be put on different supplements, and that is folic acid. You might be given a junior aspirin. You may be given calcium supplement, and in some cases, if there are people who are able to handle iron, because the first few months you might get nausea and can get really bad. Iron might exacerbate the symptoms. So iron is good, but it may not be the first one you'll be given at the beginning. But folic acid is like, you can't miss it. You just can't. Then a preconceptual education, you need it. It's very important. Your nutrition, you need to have that. You need to know when you're supposed to test for pregnancy. You need to understand the possible symptoms and the normal changes that occur in your body. Then another thing that you should not forget about care is just go to the doctor prior to getting pregnant, because you can prevent some of the adverse effects of some pregnancies. And by the way, even when you see a doctor at the beginning of the pregnancy, don't wait until 20 weeks, because most people wait for 5 months to go to the hospital. Before then, you may actually save your life if you see a doctor, because we are able to diagnose things like ectopic pregnancy even before you have a ruptured tube, if in case it's in a tube. So during your first visits, you will get your pregnancy test, and then you're going to have an ultrasound which tells us which position your pregnancy is. So, and even the first scan is very important, because it gives us the number of your expected due date, and it's almost similar and almost correct to what your last menstrual period was. So yeah, those are the important things you need to know about preconception. But if you're during your pregnancy, don't wait until you're 5 months to go to the hospital. Don't wait to miss some things like your blood group tests done, your sugar test, because blood group can cause a lot of miscarriages as well. So you need to remember, you're not testing for testing. You're testing so that you can find the problem before it affects you or the baby. So everyone who's preparing for that, please make sure you watch this video subscribe, click the like button below, and share with everyone who wants to get a baby. Yeah, and then during your pregnancy, you'll have more education on what is expected when you're supposed to have your tetanus shot. If you live in malaria endemic area, there's usually some medication you're given to protect your baby, because it gets worse when when malaria affects a pregnancy. So yeah, I hope that answers a few people and reduces the number of people coming when it's very, very late in their pregnancy. This is Dr. K, and have a nice week.